Hey, what's up everyone, and welcome back to the channel. Before we dive into today's topic, I want you to think about this for a second. Right now, at this very moment, there are millions of kids around the world whose brains are sending mixed signals to their bodies, making even the simplest movements that we take for granted incredibly challenging. We're talking about reaching for a toy, taking a step, or even just holding a spoon. Today, we're going deep into one of the most common yet widely misunderstood conditions affecting children worldwide, cerebral palsy. Whether you're a student cramming for exams, a healthcare worker wanting to understand your patients better, a parent who just got a diagnosis and is trying to make sense of everything, or just someone curious about how the human body works, this video is going to give you everything you need to know, so smash that like button, hit subscribe if you haven't already, and let's get into it. So first things first. What exactly are we talking about when we say cerebral palsy? Here's the thing that surprises most people. Cerebral palsy isn't actually just one single disease. It's more like an umbrella term for a whole group of permanent movement disorders that show up in early childhood. Let me break down the name for you because it actually tells us a lot. Cerebral comes from the word cerebrum, which is the main part of your brain, and palsy is just an old-fashioned medical term that means weakness or problems with controlling your muscles. Put it together and you've got a condition where brain damage is messing with someone's ability to control their movements and muscles. Now here's something super important that a lot of people get wrong, and I really want to hammer this point home. Cerebral palsy is what we call non-progressive. What does that mean in plain English? It means that the brain damage itself doesn't get worse as time goes on. The injury to the brain is permanent, yes, but it's not spreading, it's not deteriorating, it's not getting more severe. However, and this is a big however, the symptoms and how they affect someone can definitely change as a child grows up. New complications can pop up, and we'll talk about all of that in detail as we go through this video. Let me throw some numbers at you to show you just how common this actually is. Cerebral palsy affects somewhere between 1 to 4 out of every 1,000 babies born worldwide. That makes it the single most common motor disability in childhood. We're talking about millions of people globally living with this condition. It's a lifelong thing. But here's the good news. With the right treatment, the right support systems, and the right interventions, many people with cerebral palsy go on to live incredibly fulfilling and independent lives. Some go to college, have careers, get married, have kids of their own. So this isn't a death sentence or anything like that. It's just a different way of experiencing the world. Alright, so let's get into the science behind what's actually happening in the brain, because understanding this is crucial to understanding everything else about cerebral palsy. The fundamental problem is damage to the developing brain, specifically the parts that are in charge of movement, posture, and coordination. Think of your brain as a supercomputer running your entire body, and cerebral palsy is like having some corrupted files in the motor control section of that computer. This brain damage typically happens during one of 3 critical time windows. We've got prenatal, which means before birth, while the baby is still developing in the womb. Then there's perinatal, which is during the actual birth process. And finally, postnatal, which covers the period shortly after birth, usually within the first 2 years of life. Why are these periods so critical? Because this is when the brain is going through absolutely explosive growth and development. The brain is forming new connections, building pathways, and establishing the networks that will control everything that person does for the rest of their life. Let me walk you through the specific brain regions that commonly get damaged. First up, we've got the motor cortex. This is basically mission control for all your voluntary movements. When you decide to pick up your phone or scratch your nose, it's the motor cortex that sends out those commands. When this area is damaged, the brain just can't send proper signals to the muscles, so movements become difficult or impossible to control. Then we've got these things called pyramidal tracts. These are like the information highways carrying movement signals from your brain down through your spinal cord and out to your muscles. When these pathways get damaged, you end up with what doctors call spastic cerebral palsy, which is actually the most common type. We'll dive deeper into the different types in just a bit. Next, there's the basal ganglia and the cerebellum. These structures are like the fine-tuning department. They help coordinate movements, maintain your balance, and control your posture. When damage occurs here, people develop involuntary movements and have trouble with coordination and balance. There's also something called white matter damage, which is especially common in premature babies. This is known as paraventricular leukomalacia, or PVL for short, and it's one of the major culprits behind cerebral palsy in preterm infants. The white matter is basically the brain's wiring, so when it gets damaged, all sorts of signals get crossed. Now let's talk about what actually causes this brain damage in the first place, because this is where things get really interesting and where a lot of misconceptions come into play. I'm going to break this down by when the damage occurs because that's how doctors think about it. Starting with prenatal causes, these are things that happen before birth, and get this, they account for about 70 to 80% of all cerebral palsy cases. That number shocks most people because there's this common belief that cerebral palsy is usually caused by something going wrong during delivery, but the truth is most cases happen well before the baby is even born. One major prenatal cause is congenital brain malformations. Sometimes during development, the brain just doesn't form correctly. This could be due to genetic mutations or various problems that occur during the brain development process. Then you've got maternal infections during pregnancy, and these can be absolutely devastating to the developing fetal brain. We're talking about infections like toxoplasmosis, rubella, cytomegalovirus, herpes, and more recently, Zika virus has been added to this list. Medical students actually learn these with a handy acronym called TORCH infections. Here's something that blows people's minds. Fetuses can actually have strokes before they're even born. Yeah, you heard that right. These can be caused by blood clots, bleeding in the brain, or problems with the blood vessels. Exposure to toxins is another big one. Alcohol is a major culprit here, but also recreational drugs, certain medications, and environmental toxins can all interfere with normal brain development. Various maternal health conditions can increase the risk too. We're talking about thyroid problems, certain intellectual disabilities, seizure disorders in the mother, things like that. And here's an interesting fact. Twins, triplets, and other multiple births have a higher risk of cerebral palsy, partly because they're more likely to be born prematurely, which brings its own set of risks. Moving on to perinatal causes, these are things that happen during labor and delivery. Asphyxia is probably what most people think of first. This is when the baby doesn't get enough oxygen during birth. It can happen because of placental problems, umbilical cord complications, or really long, difficult labors, but here's the kicker. Birth asphyxia actually accounts for less than 10% of cerebral palsy cases, so even though it's what people often assume is the main cause, it's actually relatively rare. Traumatic deliveries where there's physical trauma to the baby can cause brain bleeding or injury. Prematurity is huge here. Babies born before 37 weeks, and especially those born before 32 weeks, have a significantly higher risk. Their brains are just more vulnerable to injury, and they're more likely to have bleeding in the brain or that white matter damage I mentioned earlier. Low birth weight babies, those weighing less than about 2,500 grams or 5.5 pounds, are also at higher risk. Then we've got postnatal causes happening in those first few years of life. Infections like meningitis or encephalitis, which are infections of the brain or the membranes covering it, can cause severe brain damage. Head trauma is unfortunately another cause. Car accidents, falls, or in really tragic cases, child abuse like shaken baby syndrome. Severe jaundice that doesn't get treated can lead to something called kernicterus, where high bilirubin levels damage the brain. Strokes can happen in infants too, caused by blood clots or bleeding, and hypoxic events, where the brain is deprived of oxygen from near drowning, choking, or other accidents, can also cause the kind of damage that leads to cerebral palsy. Alright, so now that we understand what causes it, let's talk about the different types of cerebral palsy because not all cases look the same at all. Doctors classify cerebral palsy based on the kind of movement problems someone has and which parts of the body are affected. The most common type by far is spastic cerebral palsy, accounting for about 70 to 80% of all cases. This type is caused by damage to the motor cortex or those pyramidal tracts I mentioned earlier. The defining characteristic is increased muscle tone. Basically, the muscles are stiff and tight all the time, making movement really difficult. Spastic CP gets further divided based on which limbs are affected. You've got spastic diplegia, where both legs are affected more than the arms. There's spastic hemiplegia, where one entire side of the body is affected, and there's spastic quadriplegia, which is usually the most severe form, where all four limbs are affected. Next up is dyskinetic or athetoid cerebral palsy, making up about 10 to 20% of cases. This one's caused by damage to the basal ganglia. The hallmark here is involuntary, uncontrolled movements that the person just can't stop. These movements can be slow and writhing, which doctors call athetosis, or they can be rapid and jerky, called chorea. What makes this type particularly challenging is that muscle tone fluctuates wildly between being too tight and too loose. Then there is ataxic cerebral palsy, which is the rarest type at about 5 to 10% of cases. This comes from damage to the cerebellum. People with this type struggle with balance, coordination, and depth perception. They might appear shaky or unsteady, kind of like they're walking on a boat that's rocking back and forth. And finally, some people have mixed cerebral palsy, where they show symptoms of more than one type. The most common combination is spastic and dyskinetic features together. Now let's talk about what cerebral palsy actually looks like in real life. What symptoms people experience, because this varies dramatically from person to person. You can have someone with very mild cerebral palsy who just has a slight limp, and then you can have someone with severe cerebral palsy who needs complete assistance with everything. It's a huge spectrum. The primary symptoms are motor symptoms, obviously. You've got abnormal muscle tone, where muscles are either too stiff, which doctors call hypertonia, or too floppy, called hypotonia. Movement and coordination are impaired, which could mean trouble with fine motor skills like writing, buttoning a shirt, or tying shoes, or gross motor skills like walking, running, or climbing stairs. Reflexes can be abnormal, either exaggerated or diminished. Posture might be unusual, with asymmetry or odd body positions. Involuntary movements like tremors, writhing movements, or sudden jerky motions are common in certain types. Walking problems are really common and can manifest in different ways. Some people walk on their tiptoes, others have what's called a crouched gait, some have a scissored gait where their knees cross over each other when they walk, and others have a wide-based unsteady walk. In hemiplegic cerebral palsy, where one side is affected, you might see a child crawling in a really unusual way, dragging one side, or only reaching with one hand. But here's the thing that people don't always realize. Cerebral palsy often comes with a whole bunch of associated symptoms and complications beyond just the movement problems. About 30 to 50% of people with cerebral palsy have some degree of intellectual disability, though it's really important to note that many have completely normal or even above average intelligence. The physical disability doesn't tell you anything about someone's cognitive abilities. About a third of people with CP also have epilepsy and experience seizures. Vision problems are really common, including strabismus, where the eyes don't align properly, problems with eye movement, or actual visual impairment. Hearing loss is more common, especially in dyskinetic CP. Speech and communication can be affected because the same muscle control problems that affect movement also affect the muscles needed for speech. Feeding and swallowing problems are common for the same reason. It's hard to control the muscles used for eating and drinking. Drooling happens because of poor control of the mouth and throat muscles. Dental problems like cavities and gum disease are more common, often because it's physically difficult to maintain good oral hygiene. Respiratory issues can develop because weak muscles can lead to breathing problems or frequent respiratory infections. Bowel and bladder control can be affected. Pain is actually a really big issue, especially as people get older, due to muscle stiffness and joint problems from years of unusual movement patterns. Osteoporosis or weak bones can develop due to lack of weight-bearing activity. Sleep disorders are common. It's hard to get comfortable when you have muscle spasms or stiffness, and mental health issues, particularly anxiety and depression, occur at higher rates, which makes sense given all the challenges of living with a disability in a world that's not always accommodating. For parents watching this, early detection is absolutely crucial, because the sooner a child gets help, the better their outcomes tend to be. Let me run through some red flags that parents and doctors look for in babies. In babies younger than 6 months, watch out for head lag when you pick them up while they're lying on their back. If they feel really stiff or really floppy, that's concerning. If they seem to overextend their back and neck when being picked up, or if their legs get stiff and cross, or scissor when you pick them up, those are warning signs. In babies older than 6 months, if they're not rolling over yet, can't bring their hands together, have difficulty bringing their hands to their mouth, or only reach out with one hand while keeping the other one fisted, these could be signs. In babies older than 10 months, if they're crawling in a lopsided way, pushing off with one hand and leg while dragging the other side, or if they're not crawling on all fours but instead scooting on their bottom or hopping on their knees, definitely talk to your pediatrician. Now I want to emphasize that every child develops at their own pace, and just seeing one of these signs doesn't mean your child has cerebral palsy, but if you're noticing several of these things, it's definitely worth having a conversation with your doctor. So how do doctors actually diagnose cerebral palsy? It can be pretty challenging because the signs aren't always obvious right at birth, and often the diagnosis is made gradually over time as developmental delays become more apparent. It usually starts with routine developmental monitoring during regular well-child visits. Pediatricians are watching for developmental milestones and using standardized screening tools. If they notice delays, they'll do more detailed evaluations. They'll take a really thorough medical history, asking about the pregnancy, the birth, family history, developmental milestones, feeding difficulties, any medical problems or infections the baby has had. The physical examination is crucial. The doctor is looking at muscle tone, posture and movement patterns, reflexes, especially those primitive reflexes that should disappear as babies develop, motor skills and coordination, and overall growth and development. Brain imaging is absolutely crucial for confirming that there are actual brain abnormalities. MRI or magnetic resonance imaging is the gold standard here. It can show structural brain abnormalities, areas of damage, malformations, all with incredible detail and without using any radiation. CT scans are used less commonly now but can quickly show bleeding or major structural problems. Cranial ultrasounds are often used in premature babies while they're still in the NICU to screen for brain bleeds or that white matter damage. Additional tests might include an EEG if seizures are suspected, genetic testing to rule out genetic conditions that can look like CP, metabolic testing through blood and urine tests to rule out metabolic disorders, vision and hearing tests to check for sensory impairments, and sometimes in specialized centers. Gait analysis using sophisticated motion analysis technology to understand walking problems and plan treatment. The diagnosis is typically made by observing the child over time. Because cerebral palsy is defined by its non-progressive nature, the fact that the brain damage doesn't get worse. Usually, a definitive diagnosis can be made by age 2, though sometimes signs are clear earlier and sometimes, especially for milder cases, it takes longer. Once a diagnosis is made, doctors classify the cerebral palsy to help with treatment planning and understanding what the future might hold. There's this system called the Gross Motor Function Classification System, or GMFCS, which is a 5-level system based on how well someone can move around. Level 1 means walks without limitations. Level 2 means walks with limitations like difficulty on uneven surfaces or in crowds. Level 3 means walks using a handheld mobility device like a walker or cane. Level 4 means self-mobility with limitations and might use powered mobility like an electric wheelchair. And Level 5 means transported in a manual wheelchair. There's also the Manual Ability Classification System, or MACS, which describes how children use their hands for daily activities, ranging from Level 1 where they handle objects easily and successfully, all the way to Level 5 where they don't handle objects and have severely limited ability to perform even simple actions. Now let's get to what everyone really wants to know: what can be done about cerebral palsy? Here's the reality check. There is no cure for cerebral palsy because the brain damage is permanent. I know that's hard to hear, but it's important to be honest about that. However, and this is a big however, there are so many treatments available that can significantly improve function, reduce complications, and enhance quality of life. Treatment is highly individualized and usually involves a whole team of different specialists working together. Physical therapy is typically the cornerstone of cerebral palsy treatment. Physical therapists focus on improving gross motor skills, building strength and flexibility, preventing or delaying muscle contractures where muscles get permanently tight, improving balance and coordination, and teaching safe movement patterns. They use exercises, stretches, and sometimes equipment like walkers, braces, or standing frames. Occupational therapy focuses on activities of daily living and fine motor skills, things like dressing, bathing, feeding yourself, writing and school activities, using computers and adaptive technology, and improving hand function and the ability to manipulate objects. Speech and language therapy addresses speech production difficulties, language comprehension and expression, swallowing and feeding problems, and helps set up alternative communication methods for people who can't speak clearly. There are various medications that can help manage symptoms. Muscle relaxants like baclofen or diazepam can help reduce spasticity, though they can cause drowsiness and weakness. Botulinum toxin, which most people know as Botox, can be injected directly into specific tight muscles to temporarily paralyze them, reducing spasticity for 3 to 6 months. This can improve function and delay the need for surgery. For severe spasticity, there's something called intrathecal baclofen therapy, where a pump is surgically implanted to deliver baclofen directly to the spinal fluid, providing better spasticity control with fewer side effects. Anti-seizure medications are used if epilepsy is present. There are medications to help with drooling, and pain medications are used as needed. Orthotic devices and equipment play a huge role. Braces and splints help stretch muscles, improve posture, and prevent contractures. AFOs, which are ankle-foot orthoses, are really commonly used. Mobility aids include walkers, canes, wheelchairs, both manual and powered. Adaptive equipment can include special utensils, communication devices, modified toys, and positioning equipment. Standing frames help maintain bone density and prevent contractures for people who can't stand independently. Surgery is considered when less invasive treatments aren't enough. Orthopedic surgery can lengthen tight tendons or muscles, cut abnormal bone growth, or realign joints. Common procedures include hamstring lengthening, Achilles tendon lengthening, hip surgery to prevent dislocation, and spinal fusion for scoliosis. There's also this neurosurgical procedure called selective dorsal rhizotomy, or SDR, where surgeons cut some nerve roots in the spinal cord to permanently reduce spasticity in the legs. This is typically done in children with spastic diplegia who have good strength. Other surgeries might be done to improve feeding, reduce drooling, or address other specific problems. Some families explore alternative and complementary therapies like hippotherapy, which is therapeutic horseback riding, aquatic therapy, conductive education, constraint-induced movement therapy, and massage therapy. While some of these show promise, the evidence for their effectiveness varies quite a bit, and they should complement, not replace, standard medical treatments. Educational support is crucial for many children with CP. This can include individualized education programs or IEPs, assistive technology, modified curriculum or testing, and special education services. Psychosocial support is also really important because living with CP affects the whole family, not just the person with the condition. This can include counseling or therapy for the child and family, support groups, respite care for caregivers who need a break, and transition planning for adulthood. Let's talk about prevention for a minute, because while not all cases of cerebral palsy can be prevented, there are definitely steps that can reduce the risk. Prenatal prevention includes good prenatal care with regular checkups, getting vaccinated before pregnancy, especially for rubella, managing chronic health conditions during pregnancy, avoiding alcohol, tobacco, and recreational drugs, avoiding exposure to infections, proper nutrition, and taking prenatal vitamins. For perinatal prevention, we're talking about quality obstetric care, appropriate monitoring during labor and delivery, access to emergency cesarean section if needed, and specialized care for high-risk pregnancies. Postnatal prevention includes preventing infections through good hygiene and vaccinations, preventing head injuries through proper car seat use, baby-proofing your home, and close supervision, treating jaundice promptly, and preventing near drowning and choking incidents. Modern neonatal intensive care has actually significantly reduced cerebral palsy rates in premature babies through advances like giving antenatal corticosteroids to women in preterm labor, using magnesium sulfate for neuroprotection, therapeutic hypothermia or cooling for babies with birth asphyxia, and just overall better management of premature babies. What about the long-term outlook? The prognosis for people with cerebral palsy varies tremendously depending on severity and type. Many people with mild CP have a completely normal lifespan. Severe CP, especially with multiple complications, can shorten life expectancy, often due to respiratory problems, feeding difficulties, or seizures. However, with modern medical care, many people with severe CP are living well into adulthood. In terms of independence and quality of life, many people with mild CP live completely independently, work regular jobs, drive cars, and have families of their own. Those with moderate CP might need some assistance but can often work and live semi-independently. Severe CP may require full-time care, but with proper support, people can still have good quality of life and meaningful experiences. Function can change over time even though the brain damage itself doesn't progress. Skills often improve during childhood with therapy. Some people experience declining mobility in adulthood due to the extra effort their bodies must exert over the years. Joint problems and pain may develop over time. The best outcomes come from early intervention and consistent therapy throughout life. Transitioning to adulthood involves shifting from pediatric to adult healthcare providers, vocational planning and employment considerations, figuring out independent or supported living arrangements, and continuing therapy and medical management into adult life. Research into cerebral palsy is ongoing and really exciting. Clinical trials are investigating stem cell therapy to see if stem cells can repair brain damage or improve function, though results so far are mixed and this remains experimental. New diagnostic tools like the General Movements Assessment can identify CP risk in babies as young as 3 to 4 months old, allowing for earlier intervention. Genetic research is revealing that some cases previously thought to be due to birth complications may actually have genetic causes, which is changing how we think about prevention. Advanced therapies being developed include robotic therapy devices, virtual reality rehabilitation, brain-computer interfaces, and improved surgical techniques. Better obstetric and neonatal care continues to reduce CP rates, especially in premature babies. Let me bust some common myths real quick because there's a lot of misinformation out there. Myth number 1. Cerebral palsy is always caused by medical malpractice during birth. The truth is, while birth complications can cause CP, they account for less than 10% of cases. Most CP occurs before birth. Myth 2. People with CP always have intellectual disabilities. Truth. Many people with CP have normal or above average intelligence. Myth 3. CP is genetic and runs in families. Truth. CP is not inherited. While some genetic factors may increase risk, CP itself is not passed from parent to child. Myth 4. CP gets worse over time. Truth. The brain damage doesn't progress, though symptoms and complications can change. Myth 5. People with CP can't work or live independently. Truth. Many people with CP work, drive, live independently, and have families. If you know someone with cerebral palsy, here are some tips for being a good ally and supporter. Treat them age appropriately. Don't talk down to adults with CP like they're children. Ask before helping. Many people with CP prefer to do things themselves and only want help when they specifically request it. Be patient with communication if speech is affected. Focus on abilities rather than disabilities. Include them in activities and social events. Educate yourself about their specific needs. Advocate for accessibility and inclusion in your community. Alright everyone, we have covered an absolute ton of information today about cerebral palsy. We've gone from the basic definition all the way through brain pathology, causes, the different types, symptoms, diagnosis, classification systems, treatment options, prevention strategies, prognosis, current research, and how to support people with CP. The key takeaways I want you to remember are these. Cerebral palsy is a group of disorders affecting movement and posture due to brain damage that happens during development. It's non-progressive, meaning the brain damage doesn't get worse, but it is lifelong. Causes vary widely, with most cases actually occurring before birth rather than during delivery like many people assume. Symptoms range dramatically from very mild to very severe. While there's no cure because the brain damage is permanent, many treatments can significantly improve function and quality of life. And with proper support, therapy, and accommodations, many people with CP lead fulfilling, productive, meaningful lives. If this video helped you understand cerebral palsy better, do me a huge favor and smash that like button. It really helps the algorithm show this content to more people who might need it. Share this video with anyone you think might benefit from understanding this condition better, whether that's classmates, colleagues, friends, or family members. And if you haven't already, hit that subscribe button and turn on notifications so you don't miss future medical education content. I've got so many more topics coming up that I think you're going to love. Drop your questions, comments, or personal experiences in the comments section below. I absolutely love reading your comments and engaging with this community, and your questions often inspire future videos. If there's a medical topic you'd like me to cover, let me know down there and I'll add it to my list. Thanks so much for sticking with me through this deep dive into cerebral palsy. I know it was a lot of information, but I hope you feel more informed and empowered to understand this condition. Remember, knowledge is power, and the more we understand about conditions like cerebral palsy, the better we can support those affected by them and work toward better treatments and maybe one day prevention for all cases. Take care of yourselves, be kind to each other, and I'll see you in the next video. Peace.